Hi, everyone. I'm just giving folks a chance to catch up. We had some technical difficulties earlier today trying to partner with our colleagues at Polaris. And so, what we're going to do right now is try to pick up where we left off. So, my name is Nani Cuadrado. I'm the Director of Education for HEAL Trafficking, and I wanted to let you know a little bit about HEAL Trafficking. And then I wanted to encourage you too to leave questions in the comments below, and I'll try to get to them as I see them. But let me let you know a little bit about HEAL Trafficking. And again, sorry, Polaris, for some reason we had technical difficulties and had difficulty joining our partnership. So anyway, let me tell you a little bit about who we are, and hopefully what we can do is work together to figure out how HEAL can help you in the work that you're currently doing. So first of all, let me tell you a little bit about HEAL. So we are an organization. HEAL stands for Health, Education, Advocacy, and Linkage. So HEAL Trafficking is this pretty amazing network of over 4,000 individuals, survivors, multidisciplinary individuals, 50 different countries, and we are dedicated to ending human trafficking, but with a public health perspective. And so that sounds a little bit strange, I think, but I think hopefully you can follow me a little bit. But what we've got going is our organization is firmly entrenched in the idea that human trafficking is a public health concern. And so what that means is the lens, everything that we look at, research, advocacy, is looking at ways to prevent human trafficking, but from a healthcare perspective. It's pretty astounding the number of folks that when they're being trafficked that actually have healthcare interaction. So it doesn't mean that they're just going to the ER, but they're seeing a social worker, they're seeing somebody from the emergency department, they might be going to their OBGYN office. And so what we do is we look at that perspective and we try to figure out how can we support healthcare providers, service providers of all kind, to help end trafficking with that public health lens. So first, let me share some of the services that HEAL offers. We offer online forums, and so if you haven't joined us and become a HEAL member, it's a wonderful way to connect with other folks that have the same passion to end human trafficking. And we look at it from a very balanced perspective, I believe. And so we offer not only online training, we offer training in person, we offer education, we look at technical assistance. So if an organization says, look, I'd like to create human trafficking protocols to help follow, we help provide technical assistance, consultation. And so again, all of that with just a wealth of knowledge and gifts of folks that really are part of just a wonderful organization. And that is survivor informed and survivor led, and really helps to navigate the complexity, because we can't do this alone and we tend to think in silos, but this is the opportunity for us with so many types of persons that have that public health lens to make a difference. So let me see, what am I forgetting? I wanted to encourage listeners today, if you haven't joined, check out the website, and that's www.healtrafficking.org. There's no periods, just healtrafficking.org. You can register for a free protocol kit. You can join, sign up for the network, and really collaborate with fabulous folks that have like minds. So if you're interested in research, if you're interested in advocacy, we have lovely partners that will help with that work together. And so the other thing I think that I wanted to share too is that we've got a wonderful Train the Trainer Academy coming up at the end of October. And so if you have not actually thought about how can you multiply your effect, Right now, we can't do it alone. And so as a team, we can actually work together. So the Train the Trainer Academy, which is at the end of October, will actually give you the tools that you need to create an impact and actually train others on ending trafficking. It takes a very balanced perspective of both labor and sex trafficking. And so I highly encourage you to check out the website and take a look at the Academy, the Train the Trainer Academy. Again, there's still time to register for it. It's at the end of October, and it is virtual. So looking forward to having you to join us at that Academy. Let's see. We have a question here. Thank you very much. It says, you mentioned that public health perspective. What does that mean? Thank you very much for that. I think sometimes medical folks speak in jargon, and my medical training is as a physician assistant. And so my apologies for not explaining that. But public health perspective means that, say, if you were to come see me in the emergency department, you would see me for a rash. I would take care of your rash, and I'm looking at you as an individual, taking care of that one problem that you have. But what a public health perspective does is it looks at a community of people. So it looks at a community of folks and says, what is happening that folks are being trafficked? So the public health perspective means that maybe we need to think about, rather than just the rash, but what can we do to prevent the rash? So you're looking at an entire community of persons being affected by trafficking and thinking about what do we need to do as a community to prevent human trafficking, if that makes sense. I hope I answered your question. Well, let me tell you a little bit more then. Thanks for that. Thanks for the clarification. So some of the pretty cool things that are happening now over the past 10 years, we're celebrating our 10th year anniversary this year in doing this work. But again, we can't do it alone. So the work that we do as we're reaching out to other organizations is looking at what, as the healthcare perspective, there is a vast knowledge. There's quite a few studies that say anywhere from 45 to 88% of folks have seen a healthcare provider while they were being trafficked. And I think that's super important because we have really a very powerful way to be able to be involved. And oftentimes that provider is not aware. So we have a great duty, not just in the ER, but they're coming to the OBGYN office. They're bringing their children to a pediatrician's office. They're showing up, bringing other persons in their family. So I think as healthcare providers, all healthcare providers, social workers and survivors that have counseling experiences, we have to start thinking about what it is that we can do in that lens that can make a difference. Let's see, it looks like another question came in. Let's see, share some experiences of Train the Trainer. I think that would be lovely. So I was sharing about the Train the Trainer Academy, and I have somebody that's actually offered to meant for them. Let's see if I can figure out how to do this. I think I've just accepted your request to come join me. Hi there. How are you, Chris?
It's so good to see you.
Oh, it's so good to be on after the little snafu we had earlier. But Chris, I would love your perspective to share what Train the Trainer did for you, and any support that you can offer, explanation that can give some light to our academy.
Sure, yeah. So for anyone who's never known about my work or the NSN, I'm Chris Ash. My pronouns are they, them. I'm the Survivor Leadership Program Manager at the National Survivor Network, and also a star performer in a local theater production of Annie when I was 10.
Well done.
I actually attended the Train the Trainer when it was in person in 2019. I was in the inaugural cohort, and while I'm a survivor of trafficking, and that happened a really long time ago, and while I've been doing anti-violence work for also a really long time, I had only recently started doing a lot of work within the anti-trafficking movement the year before, and I was feeling lost and disoriented, and was finding a lot of it confusing. And I signed up for this Train the Trainer. I applied, was sure I was not going to get selected. So getting to go be there in space with other people. And in the years since, I've come back as a co-facilitator to help lead the Train the Trainer. And you are in a room with some of the most passionate people you've ever seen. Some of them you've never met or heard of before, but there's always a few people whose work you've probably heard about and been following. So it's like being in a space with these rock stars all learning from each other. It was the best networking ever for me. There are still people from my initial cohort that year that I'm still in touch with and have been close with. There's even people from the previous years where we've done it virtually, where we've stayed in touch. We have a WhatsApp group where we still share questions and get ideas from each other. It's just such rich learning. It just really kick-started my whole career, in terms of moving out of doing just the work I had been doing and really moving into a training space. It had a huge impact for me. I think the other thing I would add is that in the last year's Train the Trainer virtually, the NSN was able to fund 5 of our members to go and attend. And so one of the things that they came back with was how powerful it was. You know, I know today in some of the other sessions we've talked about how survivors are often seen in this movement as only having their stories to bring. And so for a lot of them who that had been all that was available to them, they reported back afterwards that attending the Heal Train the Trainer was life-changing, because here they are in rooms with doctors and nurses and trainers and social workers, and they're all treating them and each other like equals and like colleagues and learning from each other in this real mutual space. So if there's anyone in this call who's working in the field and really wants to up their training game, I can't recommend it enough.
Thank you. I'd love to ask you a question if you don't mind, Chris. Thank you for that vote of confidence and for your experiences. I think as we look at multidisciplinary and the work of training others, what do you think is our biggest challenge in training? I think everybody talks about, yeah, I'm out there, I'm training, I'm giving classes, but what do you think truly is a challenge that maybe the Train the Trainer course helped to write for you?
I think it helped in a few things. One of them was we talk. I know you mentioned it earlier with public health. We talk in jargon, and one of the things we talked about in the Train the Trainer and learned was how to make it accessible, how to teach things to people with multiple different teaching styles so that people can get some piece of it that lands in the way that they learn. I think another thing that's really hard in training spaces is that sometimes people come to trainings and they're maybe, 25% excited to learn, but 75% adrenaline pumped because we're talking about trafficking and it's, like they're coming with their hero complex kicked up a little bit already.
Yeah.
They're like,
Yeah.
I want to save people. And the Train the Trainer gives us some really good skills for both like honoring that impulse, while directing it into real education about what people might need and how they might want to be approached. Because a lot of people, the rescue is, I'll never forget, there's even one slide where they talk to us and it shows someone hanging from a helicopter, on a rappelling down to reach into the waters and pull someone out. But a lot of times that's not what someone wants, or maybe a lot of times they're just not ready for that yet. And they keep coming back to you if they don't trust you. Right? Sometimes you might see someone several times before they're ready for any kind of assist, and even then, they're the hero in their own story, right? Like they're the hero that does the rescue themselves in their own way. So it was a really cool thing to have people honor that to give us skills for talking to people about how that comes from a good place. Like all of us want to end trafficking. You can't hear stories about things that people have been through, or if you're a healthcare provider, see these impacts of it on their lives and on their bodies and not feel like you want to do something. And also, you know, that beautiful impulse, it's a lot slower and harder to build trust, but boy, is it more powerful in the end. And so having that way to talk about that was super helpful for me.
I really appreciate that. I think what I find most helpful also in this type of training, and Michael, if you go to the HEAL website, I see there's a question about where is there more information. If you go to www.healtrafficking.org, there'll be information on the Train the Trainer course and how to sign up for it. But one of the things that I thought about is I'm a clinician. I don't know how to teach, especially adults. And you can tell that some folks, just like you said, not everyone wants to be there. Sometimes it's part of a job requirement. And so how do we reach folks and how do we talk about adult learning? Because, you know, the amount that I can absorb as an adult versus what I did as a child is different. So I feel like that's another thing the Academy does well, and that's help with just adult learning. How do I reach somebody that maybe is a visual learner and they prefer like images, or how do I reach someone that's more of a read write person or kinesthetic and they like to do things? And so I think it also helps to really bring everybody to the same level. I feel like that's a helpful thing as well, because like you said, we all bring our experiences and there are no heroes. This is all about providing information in a trauma-informed way. And I think I should probably talk about what that means too, because that's another medical jargon, you know, that we tend to throw around. But I think when we speak of trauma-informed, it's a term that is a horrible term if you don't get it, I think. And what that means is we're looking at the person as a whole and trying to really build this trust. And I think that's really what trauma-informed is about, is providing privacy. It's providing a safe space for someone to share their story when they're ready. It's providing education and information, whether, and normalizing it, you know, not saying like, here's a brochure or here's what you do, but it's really about providing information to somebody and say, well, you might not need it now. Maybe you have a friend. It's really about that perspective, that I think that lends itself to trust. And we're not going anywhere. And Chris, I'm sure you can attest to that. Without basic just belief in each other and a sense of trust, I'm not going to get any kind of information from anyone if I come in very judgy and really without a perspective that somebody is suffering inside, and just giving that perspective. And I think this brings everybody together, this Academy. I know we're talking so much about the Academy, but I think it's a super exciting because we still have time for people to join us. So.
And you talking about the trust, I know you just named some of the letters in the PAIR tool.
Yeah.
Life. Everybody I train, I want to be like, look up the PAIR tool. And that's PEARR. And that is something that HEAL created for advocates, social workers, clinicians, anyone in any setting can use this. But I love it because it's about, like what you kept talking about, this trust and the respect. You create conditions where someone wants to disclose something they can't. I know a lot of times we have people who are like, how can I tell if it's trafficking or not? What is the screening tool with the highest success rate? And they get so hung up on whether or not someone is a survivor and do they check the right boxes that they forget this is a human sitting with you. I can share, it's very, I go on and on in the movement about survivor storytelling being overused and exploitative, but I share them when I want to. And during a really rough time, not too far after my trafficking, I remember going in to see a psychiatrist because I wanted to get medication. I was really struggling. And this person, for starters, looked like they were 12 when they finished with their medical degree, but it couldn't have been that ago if they were
a Doogie Howser.
It was a Howser, right? And he had his foot. like, this is not a clipboard. This is somebody in my home's switch, but he had his clipboard up here and I could just barely see his glasses over the top of it. And he was asking me this screening list. And at one point he said, and I'm just feeling like I'm sitting there. I'm just like a guest in whatever clipboard paper he's in. Like, right, it's not about me, it's about his clipboard. And at some point, one of the questions he says, do you believe you have any special powers? And he hadn't even looked up once. And I was like, yeah, I can melt toilet seats with my breath. And he literally looks up from his thing, like, and he's just like, and that was the first time he had made eye contact with me. He didn't even laugh either, which tells you something about his frame of mind. Of course, I can't melt toilet seats with my breath, but it was just one of those moments where I so strongly felt like this is not someone I want to disclose anything to. This is not someone I want to talk about what my dark feelings and thoughts are in this moment or my past traumas. This is someone who I just want to check his box. I want to say what I need to say to get the medicine that I think I came there for, and then I want to get out. Mm-hmm. Feel like I have a relationship, and that's what I love about this pair tool is it's less focused on like, are you a survivor? Do you check my boxes? And it's more about like, hey, if we let people know that we're here, we give them privacy. We educate them about the issue just in case there's something that they aren't knowing about. We ask them, and not like, are you a survivor? But more like, does this sound familiar? Like something maybe you or someone you know have been through. And then we respect what they say, because they may in that moment, they may need more trust building, and they may say, nope, not familiar. I'm good. I just came here to get my broken bone fixed, and then we respect that. Mm-hmm. Right? We don't keep pushing, we respect it. Or if they say, yeah, it does sound familiar, then we respond. Mm-hmm. Because we're being invited into that person's world, and we're not like trying to manipulate it and, dance, monkey dance, check the box, right? We're like, care about you.
Thank you. I love that pair tool, and I'm very proud that Heal has helped to create that tool. And I feel like it's actually embarrassing, and I'm sure care providers who are out there, many did not get trauma training. I don't mean trauma like you fell down and hurt yourself, but many of us did not learn how to speak to folks in a way that has any modicum of compassion. And I think, folks that have lived experience, more than anyone that having the skills to know what's safe and who to trust, like that's survival. And so they can detect, just like you did, someone who's BSing, somebody who is really not present with you. And I think that's something that I love about all the partners that are part of Heal, is that no matter what your skill set is, that everybody that's a part of the Heal community and partners in this work really look at ways to be present as a community, because we're not in the situation without having failed people. And so we have failed as a community, and it's not a bashing ourselves thing, but what that means is the opposite. To heal literally is to do the opposite of what it takes. So if somebody was isolated, then we create community. If somebody, I think that's what we all feel that at Heal, and our colleagues that we partner with. And so I'm super excited that we've had this opportunity even to just kind of chat, Chris, because I think, first of all, you and I haven't chatted enough, but I think what we really can do and connect is look at ways. I saw there's a bit of chatter within the Heal community, because there's some, like you said, some physicians that are saying, we need training for medical schools. Like, why isn't this required? And like, amen to that. But then there's this great chat. Oh, well, we're starting this and we're doing this. And so just to watch the conversations going as people are trying to advocate for changing curriculum, to advocate for changing the way schools look at training, is phenomenal. So I highly encourage folks to join the community of Heal Trafficking, whether you're a survivor with lived experience, whether you have your own organization like Chris does, and really finds that kind of support in each other. It's really just the start of the work that needs to be done, because it's really not the silo anymore. And I think for far too long, anti-trafficking movements have been about kind of almost funders pit other organizations against each other. And I feel that in this work, the more we collaborate, the more we work together. It's not about the competition, that it's about the partnering. And so we have to find a way to actually speak to our funders and people that want to fund efforts like this, to really encourage them to encourage collaborative efforts rather than divisive efforts. And so I don't know, I feel like this is a really great start to good conversation. Let me see if there's any other questions, because I could just yap on and on, just kind of like you said, you could just go on and on. Does anyone else out there have any questions or any comments? You can put them in that little question box there for either Chris or myself. We'd love to entertain that. Now I'm dragging Chris in with me because
I am the Heal Speakers Bureau.
Yes, you are, my dear. And so I think what we are here to entertain is any questions about Heal, the Speakers Bureau. We have a Speakers Bureau. There's lots of good training out there. There's consultation. So if you're an organization out there that says, I think I'd like to establish a protocol for human trafficking, there's actually a free protocol kit on the website, and we provide consultation to help with that. So
how people can advocate. So maybe if you have in your local healthcare systems, whether it's that you've got friends who work at the hospital or administrators, make sure they know about HEAL. But the protocol toolkit, I can't tell you the number of times I've heard people say, we need to develop a protocol for our local hospital to respond to trafficking, and we're going to start from scratch, and we have very little budget, and we're going to bring together 2 local doctors who saw a couple of trafficking patients once, and it's like, there's already this beautiful protocol toolkit out there. It's so good. Put your hospitals and healthcare systems in touch with that. Give them that information. Let them know that HEAL has a Speakers Bureau. We all the time on the Speakers Bureau get requests from people who want to have a speaker come and deliver training at a medical association conference. I know I spoke at the Tennessee Hospital Administrators conference once with Nani. But speakers at conferences, trainings for your organization, we can do this so that you're not stuck having to invent the wheel when there's already a really incredible one out there that you could adapt for your use.
Absolutely. Thank you for that. Another plug. Boy, you're on it. Thank you. So I see probably the last question before I have to wrap this up, but Michael asked, how can a non-clinician get trauma-informed training? That's easy. If you go to the website, there is there on the Speakers Bureau, you can actually click on a link to get a speaker's request. So we have such a wide variety of talent on the Speakers Bureau, from social workers to non-clinical, and we've provided trainings for folks that don't have clinical skills. So we can do all that. Just community that wants to be involved and know how to stay connected. So feel free. Please go to that website. Let's see. Could you post links with all the resources you mentioned after the live? I will. I am probably the most technically illiterate person that you might know, but I will definitely post links. I wonder if I can do that.
And I know I can, while Nani is looking at that, I can share with you that for non-clinicians, so at the NSN, a lot of the training that we do is for people with lived experience who may not have a whole lot of fancy professional credentials to learn the basics of working with trafficking. So on our YouTube channel, if you go to YouTube and National Survivor Network. Sorry, my cats are fighting. It's a National Survivor Network on our YouTube channel. We do have a few really accessible trainings on trauma and trauma-informed care and active and reflective listening and some very basic fundamentals.
Love it. Thank you very much. Well, I don't see any more questions in the chat, and I think we're out our 30 minutes. But Chris, it's a pleasure. Thank you for your support, and thank you for being on our Speakers Bureau and just being a colleague that is trustworthy and a lot of fun. So I'll look forward to working with you again, Chris. Thank you, everybody, for joining Heal Trafficking. Sorry for the technical difficulties earlier with Polaris. They tried really hard, but we really had difficulty getting connected on our partnering Instagram Live. So I thank you, everyone, for joining us, and thank you, Chris, for your time and the love, and for being such a great speaker for our Bureau. Take care, everyone. Have a good night.